New York's medical marijuana program first became law back in 2014 with the Compassionate Care Act, but it's taken years for it to become fully implemented.
WENY's Isabel Garcia investigates patient access here in the Southern Tier, where the number of certified doctors remains limited. She joins us now in the studio with a special report. Isabel.
Nick, Renata, according to a 2-year program report, as of June 2016, there were 11 registered practitioners in the Southern Tier. Now that's compared to more than 50 actively certified patients. I spoke with one registered doctor in Owego about the challenges both patients and doctors face when it comes to accessing the new form of medication.
It's very limited. It's hard to find somebody who's certified and willing to do it, and a number of people have said that they had to wait a long time to get the appointment and that it was frustrating and so forth. So yes, definitely need more doctors.
Dr. Keith Nichols is registered under New York's medical marijuana program and operates a private practice in Owego, New York. He began issuing certifications about 1.5 years ago and has now approved 107 patients.
Most of the ones that I've certified for it who've given me feedback it's been very positive. It's helped them reduce their chronic pain, it's helped them with their Parkinson's, it's reduced their muscle spasms. It works well.
Under the rules of the program, a patient must see a registered doctor first, then apply online for a registry ID card, then visit a dispensary to obtain the medicine. In Owego, Dr. Nichols says his patients come from across the Southern Tier and then have to travel again in order to get their medication.
Almost all the patients have gone to the dispensary in Johnson City, New York, which is run by the company called Verio, V-E-R-I-O. I think the next closest dispensary is in Syracuse.
Dr. Nichols explains the benefits of the newer form of medication range from pain and anxiety reduction to reducing tremor and seizures. Another benefit, limiting other medicines.
People that I've certified for the marijuana, the ones that are currently or were using opioids of one type or another, in almost every case they were able to reduce and in a couple cases eliminate the use of the opioid.
However, for his patients, a challenge they often encounter which limits accessibility is insurance coverage.
Some people, even though they get a great benefit from it, they can't afford it because if they use an opiate, it's covered. If they use marijuana, it's not covered, so they have to pay cash for it. It's somewhat ironic, but that's the way it is right now. Hopefully that will improve.
One mother from the Southern Tier who wished to stay anonymous has a 5-year-old daughter with a genetic mutation called tuberous sclerosis complex. That causes benign tumors to grow on vital organs, which in turn cause seizures. Those began when she was around 15 months old. To protect the mother's identity, we altered her voice for this interview.
After she started having the spasms, it just didn't stop. We tried, I think total we've tried over 15 medications now.
As her daughter's condition began to get worse, Mom was looking into the very difficult decision of brain surgery. During a visit to her daughter's neurologist in Boston, an opportunity came up for her daughter to be a part of a pharmaceutical trial involving CBD oil.
March she started it, and then in April was her very last tonic-clonic, up to date, so almost 2.5 years now.
She says the family was lucky to be in the right place at the right time to be enrolled in the trial, but obtaining the medicine her daughter now critically needs remains a challenge.
It's not easy. We have to go with a toddler, 7 hours up and back every 4 months for the medication, to pick it up. And it right now, it can't be shipped to us because it is, like I said, I told you, it's from a pharmaceutical company. So it's not just from a random dispensary. We can't just go pick it up somewhere.
Mom is reserved to transition her daughter to New York's medical marijuana program, mainly because she sees a gray area when it comes to how the medicine is distributed.
They have scientists, they have a lab, they literally have, the same exact formula every single time. We know every single bottle is the same formula. Whereas if I went to a dispensary, I can't guarantee that.
While New York's medical marijuana program continues to expand, there is still a need for more doctors and dispensaries.
I'm enthusiastic about it, and I wish more doctors would get, the certification ability, because I see people from Elmira, Horseheads, Ithaca, and east of here. There just aren't that many doctors who are doing it at this point.
And as far as expansion goes, Governor Andrew Cuomo just announced on Veterans Day the list of qualifying conditions will now include post-traumatic stress disorder. Also, there is a planned dispensary coming to Chemung County under the company Sativa. Now, we've reached out to that company via phone and email multiple times over the past month, but have not yet heard back. Reporting in the studio, Isabel, Garcia, WENY News.